Hi guys, so my name is Michelle Spoon. I'm doing my presentation on hospital-acquired infections. Why am I doing this study? To answer the PICOT question and to determine if patients being admitted to the ICU, being cared for by nursing staff, whether they're temporary, part-time, or permanent, has an effect on exposure to the hospital-acquired infections or not. So we know that hospital-acquired infections are also called hospital-associated infections. They usually occur 48 hours after being admitted. They can result in a long-term care, mortality, as well as the increased cost to medical facilities. According to the CDC in 2021, hospital-acquired infections in the United States costed medical care $28.4 billion alone, just because of hospital-acquired infections. Methods used were the qualitative and quantitative studies. Data was collected through systematic databases using patients' personal demographics and information from the hospital, what their risk factors were for exposure, and nursing notes regarding the evaluation of the patient, as well as the hospital-acquired infection, what microbiology cultures were performed, when it was taken, and what the infection actually grew out. Nursing and nursing assistant staff was also looked at through payroll to determine what the staffing was like on certain days. Interviews as well were performed to nurses to determine what their level of knowledge was caring for patients with such lines to determine what their knowledge is. Some of the most common hospital-acquired infections are your surgical site infections, pneumonia, urinary tract infections, and bloodstream infections. The CDC in 2022 identified that between the years of 2020 and 2021, there was an overall increase in Klebsiella, Caudy, and VIE infections throughout the hospital, as well as a higher increase in the ICU. Patients in the ICU have been found to have a higher risk of getting a hospital-acquired infection by 19.5%. How transmission works. So microorganisms can be anything but from viruses, funguses, bacteria, and even parasites. So patients come to the hospital. Why? Because they're sick. They have these viruses. They have something going on that they're not sure of. They're coughing, they're sneezing, they're breathing. They're not washing their hands after all this. So they're sneezing into their hands. They go ahead and touch the doorknobs, the countertops. They're touching their bedside rail. Nurses walk in or healthcare personnel walk in. They do wash their hands, great. Now they've touched the areas that the same patient had touched that's now contaminated. When leaving the room, they may not wash their hands afterwards. Now they're going to see another patient who might be susceptible to any kind of infection. They've now taken one bacteria or parasite or fungus from one patient and has now brought it to the next patient. The most contaminated areas in the patient's rooms are the bed, the side table, patient's belongings, flat surfaces, the furniture, all areas that we think might be clean may not actually be cleaned. So Anderson did a study to determine if surfaces found in patients' rooms does actually have an impact on microorganisms and the spread of hospital-acquired infections. That result actually did show that patients that are in contaminated rooms that were not properly cleaned can actually result in the spread of an infection. Further reasons for hospital-acquired infections are short staffing. Hospitals, unfortunately, are seeing short staffing and overcrowding of facilities, which is leading to the increase of the non-compliance of good hand hygiene when caring for patients. One article or study that I had found suggested that staff from agencies, as well as floated nurses from different units, there was an influence in the increase of central line hospital-acquired infections due to the lack of attention to these lines, as well as to the lack of knowledge to caring for these lines. A second study that I had found also showed that there was a positive correlation as well with the bloodstream infections increasing from central line handling due to the lack of knowledge or training that the nurse had caring for these patients. In conclusion to my study, this topic is very critical when it comes to nursing. Nurses are hands-on with patients majority of the day. They know if a patient needs an access still, if that central line can be moved, should that fully be removed. These are questions you should be asking your doctor if these lines are actually necessary. If they're not, just have them removed. Having unnecessary lines removed will decrease the patient's risk of getting a hospital-acquired infection. My IPOC question, unfortunately, was not answered fully either. Further research still needs to be done with larger groups of people or patients, as well as it was undetermined if the susceptibility of having COVID-19 and these device-related infections were truly valid or not. And lastly, the staffing. Yes, it is an issue. However, not exactly sure if it's the short staffing or just the knowledge base of caring for these lines and these patients is truly what the issue is. What I did know, or what I did learn, is that proper infection control, such as hand washing before and after seeing patients, as well as proper cleaning of these rooms and the patient care areas, can, in overall, have the healthcare system achieve the most for their patients, save money, and decrease the patient's exposure to hospital-acquired infections. Thank you for taking the time to listen to my PowerPoint. Have a great day.